Oxygen is transported in the blood in two forms, one in dissolved form and another in combination with hemoglobin. In dissolved form, the amount of oxygen transported is 0.3 ml per 100 ml of blood per 100 mmHg of PO2. The dissolved oxygen obeys Henry's law, that is, the amount of dissolved oxygen is proportional to the partial pressure of oxygen. Dissolved oxygen assumes its practical importance in cases of hyperbaric oxygen therapy when this amount can be increased by giving oxygen at high pressure, as in the treatment of carbon monoxide poisoning, gas gangrene. Here Hb gets denatured. In combination with hemoglobin, each hemoglobin molecule has 4 heme groups which can have iron in ferrous form. The sixth valency bond of each ferrous combines with 1 mole of or 2 atoms of oxygen. Therefore, 4 moles, that is 8 atoms of oxygen, combine with 1 mole of hemoglobin. The oxygen carrying power of hemoglobin is given by oxygen hemoglobin dissociation curve. It is the curve relating percentage of oxygen saturation of the hemoglobin to the partial pressure of oxygen. The curve has a characteristic sigmoid shape due to shifting affinity of hemoglobin for oxygen. So this is the oxygen hemoglobin oxygen dissociation or association curve, where it shows the relation between the partial pressure of oxygen with the saturation of hemoglobin. You can see the binding nature of oxygen with hemoglobin is going to vary at different levels. So initially it is linear, and as the partial pressure increases from 20 to 40, so there will be a drastic change in the affinity for the oxygen to hemoglobin, and then after 60 from the 60 mmHg partial pressure, the saturation is going to not change much, it remains plateau. In deoxyhemoglobin, the oxygen portion is tightly bound in a tense configuration, thereby reducing the affinity of the molecule for oxygen. Combination of molecule with oxygen releases bonds holding the globin units, producing a relaxed state of configuration. This results in exposure of more oxygen binding sites, and thereby the affinity of hemoglobin molecule with oxygen increases. Since 4 atoms of iron ferrous do not combine with oxygen simultaneously, we do not get a vertical line. The combination is a stepwise process, and the affinity of oxygen is different at different steps. The combination of first heme in the hemoglobin molecule with oxygen increases the affinity of second heme for oxygen, and so on. This shifting affinity of hemoglobin for oxygen due to the tense and relaxed form interconversion produces the characteristic sigmoid curve, and this phenomena is referred as heme to heme interaction. Physiological advantages of S-shaped curve. It allows the greater uptake of oxygen at lungs despite great variation in the alveolar PO2, that is from 95 to 60 mm of Hg. And when PO2 is below 60 mm Hg, a small fall in PO2 causes significant reduction in the percentage of saturation of hemoglobin. This means that peripheral tissue can withdraw a large amount of oxygen for a small drop in tissue capillary PO2. This behavior of hemoglobin enables uptake of oxygen in the lung where PO2 is high, and release of oxygen into the tissue where PO2 is low. Oxygen content. It is the actual amount of oxygen present in the sample of blood, that is 19.4 ml per 100 ml when it is saturated 97.5%. Oxygen carrying capacity is the maximum amount of oxygen that a particular amount of blood can combine with at full saturation. 1 gram of hemoglobin can combine with 1.34 ml of oxygen. So at max PO2 of approximately 120 mm of Hg. Since the average hemoglobin concentration is 15 gram percent, therefore 100 ml of blood can carry 1.34 into 15, that is equal to 20.1 ml with a full saturation. The percentage of saturation of hemoglobin can be given by the formula by oxygen content divided by oxygen capacity into 100. Normally it is around 97.5%. Utilization coefficient is the percentage of blood that gives up its oxygen as it passes through the tissue capillaries is called as utilization coefficient. Normally it is 25%. During strenuous exercise, the utilization coefficient increases up to 75 to 80%. In some area where blood flow is extremely slow or metabolic rate is very high, the utilization coefficient is approximately 100%. Factors which affects the oxygen hemoglobin dissociation curve. Factors which affects the curve or help shifting the curve to the right side. A shift to right occurs if affinity of hemoglobin for oxygen decreases. Some of the causes are fall in the blood pH or increase in the H plus ion concentration, increase in the partial pressure of carbon dioxide, which occurs because of the respiratory or metabolic cause, increase in the temperature, increase in the concentration of 2,3-DPG, where 2,3-DPG is the product of glycolysis. It is highly charged ion that binds to beta chains of deoxyhemoglobin. It competes with oxygen for the binding sites on the hemoglobin molecule, and therefore at given PO2, the percent of saturation of hemoglobin with oxygen will be reduced in the presence of 2,3-DPG. Bohr's effect. Increase partial pressure of carbon dioxide content of the blood helps to release more oxygen from hemoglobin. This is called as Bohr's effect. It can also be explained as the decrease in the oxygen affinity of hemoglobin when the pH of blood falls. The Bohr effect is useful during physical exercise when more carbon dioxide is produced and more oxygen is delivered to the tissues, an active tissue gets more amount of oxygen. Shifting of ODC curve to the left side. A shift to left occurs when the affinity of hemoglobin towards oxygen increases. Some of the causes are decrease in the body temperature, increase in the blood pH, that is decrease in the carbon dioxide levels, fetal hemoglobin, myoglobin, decrease in the concentration of 2,3-DPG, and carbon monoxide poisoning. They're going to shift the curve to the left side. The affinity of fetal hemoglobin for 2,3-DPG is considerably less than that of adult hemoglobin. The poor binding of 2,3-DPG by gamma polypeptide chain. That is the reason. So hemoglobin F shifts the curve to the left side. That is, a lower PO2 is required to bind a given amount of oxygen. Thus, the affinity of hemoglobin to combine with oxygen is more than that of adult hemoglobin. Myoglobin contains only one heme group with one polypeptide chain, that is one atom of iron per molecule. So molecular weight of the myoglobin is 1/4 of that of hemoglobin. Its dissociation curve is rectangular hyperbola. It takes up oxygen from the hemoglobin in the blood and releases oxygen only at low PO2 values. That is, the rate of association of myoglobin with oxygen is very fast. It does not show Bohr effect. Carbon monoxide shifts the curve to the left due to the inhibition of synthesis of 2,3-DPG. Affinity of carbon monoxide to combine with hemoglobin is 200 times more than that of oxygen. Due to the larger proportion of carboxyhemoglobin formed, Hb is unavailable for oxygen carriage. So this diagram showing the shifting of oxygen dissociation curve with a decrease in the pH and increase in the pH. So decreasing the pH shifts the curve to the right side, and increasing the pH shifts the curve to the left side. Similarly, the temperature increasing the temperature shift the oxygen dissociation curve to the right side, and the decrease in the temperature shifts the oxygen dissociation curve to the left side. Here you can see the difference in the normal adult hemoglobin and normal fetal and myoglobin. And the fetal hemoglobin and myoglobin, the oxygen dissociation curve is going to shift more to the left side. P50 means the PO2 at which hemoglobin is 50% saturated with oxygen. The normal value is 26 mm of Hg at PO2 40 mm Hg and pH 7.4 and temperature 37 degrees Celsius. It helps to determine the hemoglobin affinity for oxygen. The hemoglobin affinity for oxygen is an inverse function of P50 value. That is, the higher P50, the lower the affinity of